Good morning, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C. Today, we're going to provide a quick briefing about the district's response to this week's heat emergency and COVID-19. We are in the middle, I don't have to tell you, of some very oppressing and hot days. On Saturday, we activated the heat emergency, and that heat emergency will be in place through this Wednesday, July 22nd. We have been planning, of course, as we do every year, for how we will respond if we have a heat emergency, and DCHCEMA is our coordinating agency to work with all DC government agencies. So we are providing a list of cooling centers that will open today. If you are in the need of a cooling center, you will find one or a couple all across the city in all 8 wards. And the list is here. I'll just read through them. In Ward 1, well, that's actually Ward 4. But let's just say in Petworth, at Petworth Recreation Center, 801 Taylor Street Northwest. In Ward 2, the Volta Park Recreation Center. In Ward 3, the Hardy Recreation Center. In Ward 4, another at the Hamilton Recreation Center. In Ward 5, the New York Avenue Dunbar Recreation Center and Dunbar High School. In Ward 6, Randall Recreation, Seton Elementary, and Watkins Elementary. In Ward 7, the Marvin Gaye Recreation Center, Aton Elementary, and Randall Highlands Elementary School. In Ward 8, at Congress Heights Recreation Center in Patterson Recreation Center. Let me just mention also that the National Weather Service has actually upgraded the heat emergency to an excessive heat watch with the heat index forecast between 110 and 115 degrees. I'm going to pause for a moment and ask Chris Rodriguez to say a little bit more about HCEMA's coordination of heat emergencies and what that means for the district.
Thank you, Mayor Bowser. As the mayor had mentioned, she did activate the heat emergency on Saturday. That will run through Wednesday. As of about 20 minutes ago, we are reaching 100 degrees in terms of our heat index. Today, we expect that to go up to about between 108 and 110 for our heat index today. And just for folks to know, the heat index is a combination of the air temperature and the humidity in the air as well. And despite the fact that it could be, for example, 95 degrees out, the heat index takes into account the humidity. Some of the things that we want to mention is please go to heat.dc.gov. As the mayor mentioned, you can see a list of cooling centers throughout the district, as well as tips for making sure that you stay cool and making sure also that you're looking out for whether it be your family members or neighbors. DCHCEMA will continue to coordinate with the DC Department of Human Services and with Department of Parks and Recreation, DCPS, to make sure that the sites are employing some new measures amidst the COVID-19 pandemic. The first is that anyone entering a cooling center must wear a mask. If you do not have a mask, one will be provided to you. And also working with the DC Department of Health, making sure that those centers also have proper social distancing in place for any residents that might utilize them. So thank you, Mayor.
Thank you, Chris. And let's also look out for our neighbors experiencing homelessness. And if you notice someone who is in need of a cooling center, transportation will be provided for them. So please call us at 202-399-7093. 202-399-7093. You may also always call 311 to get in touch with the city. And of course, if you are experiencing a medical emergency, please call 911. Yesterday, we announced that we would be closing the public testing sites in the district that are all outside. The temperatures will be too dangerous for our staff and volunteers at the public testing sites, as well as the grocery sites where patrons and staff are outside. And we will announce when those public testing sites can be up and ready. Dr. Nesbitt is constantly monitoring all the private providers who are providing testing, and most of those locations are inside and would be available. So if you're in need of testing, please call your provider. However, meal sites will be open, and the full list of the meal sites are at coronavirus.dc.gov. And once again, residents are encouraged to call their providers if they are in need of a test today or if they're not feeling well. We're going to turn to a few updates around contact tracing, and Dr. Nesbitt will address these as well. And we have added a new graph to the daily. I think this will be part of the daily information provided. The new graph reflects the percent of positive cases that are associated with quarantine contacts of positive cases. So, Dr. Nesbitt.
Yes, thank you, Madam Mayor. We have talked about some of the metrics that were of concern for us and some of the things that we wanted to look at while we are in phase 2. One of the metrics that will now appear on the dashboard is the percent of positive cases from quarantine contacts. So we wanted to have the opportunity to give people a tutorial on how to review this new metric on the dashboard. What you will see is the dash line at the top shows where we want to be or what our goal is for this metric. The shaded gray bars are the daily number of new cases that we present. So those are the positive cases, so you'll see that shaded there. The smaller, unfortunately, the smaller darker gray bar is the number of positive cases that are announced for that day, or presented for that day rather, that arise from quarantined contacts. So ideally what we would want to see when I talk about having more of our cases be connected to each other, meaning that we have less evidence of community spread, meaning that our cases are connected to each other, our cases are occurring in clusters, meaning that we have more evidence of containment in the district, would be that that shaded gray bar and that darker gray bar are one and the same, that they are covering each other. Or ideally is that that dotted line would be at 60%. So it doesn't necessarily have to be at a match for us to be seeing that we are moving closer to containment. If they were right on top of each other, we'd be at 100%. As you can see, we are at 2.6%. So when I'm talking about our cases are not connected to each other, so we don't have many of our cases coming out of quarantine, or many of the cases that we are diagnosing are not people who were previously identified as being contacts of a positive case, or people who were already in quarantine. So that's the best way to understand this graph. So many of the people who are being diagnosed with COVID-19 in the district are not people who were already in quarantine, are not people who were already someone else's close contact. As you could imagine, if the light gray bar were a much smaller number, like 7, 8, 10, we'd also have a higher likelihood of the people who were being diagnosed in the dark gray being much higher. So again, as we have fewer and fewer cases, we're more likely to be able to have our new cases be people who were already in quarantine. So as we decrease the overall number of cases, We're more likely to have the cases that are new be people who are already in quarantine, meaning that they were someone else's close contact. And this is the concept of having more people being clusters or fewer sporadic cases. So that's that metric. You'll start seeing it on the dashboard under our contact tracing. If we go to the next slide, there are some things that we're going to be doing in the district to help us improve our contact tracing program overall. There's a few metrics that we look at, and you may have heard some of this conversation nationally around contact tracing efforts. We're going to be activating a home visit team. Home visits for infectious diseases is not new. We've used this model with some of our other infectious diseases, such as sexually transmitted infections and TB. And so we're going to begin to use this as one of our COVID-19 response programs. We're going to launch the program next week, focusing on the highest risk populations. Individuals who have not completed interviews will be the priority groups. And we will also be able to increase our ability to assess if individuals have social service needs, housing needs, meaning that they have a difficulty isolating from other people in their homes, or don't have the ability to quarantine, et cetera. One of the metrics that looks really good in our internal metrics is the proportion of individuals who have valid contact information, meaning when we make a phone call attempt, the voicemail that they have set up identifies it as them, or someone else answers the phone and does state that that individual resides at that address, or that they could eventually be contacted. So we have a high likelihood of success with this potential program. So that's all I have, Madam Mayor.
Thank you so much, Dr. Nesbitt. And finally, before we take your questions, we just want to remind everybody of our shared responsibility to protect each other and our city, and a reminder to wear a mask when you are leaving the house. Keep a 6-foot distance from everybody, and choose your activities wisely. And we know those are good reminders. There are others, including staying at home if you're feeling sick, being obsessive about washing your hands, and I'm sure I'm forgetting something other than, did I mention choose your activities wisely? Ask yourself if you really need to go out, or if you really need to be at an activity. So with that, I also want to acknowledge that we've been joined by the City Administrator, Rashad Young, and the City Administrator, our budget team, the CFO, the Council of the District of Columbia have been working overtime on a budget, on a balanced budget. We continue to have some recommendations for the council to improve on the budget that they voted on preliminarily a couple of weeks ago, which we have shared with the chairman of the council. Okay, any questions? Yes, ma'am.
It's my understanding that some of the summer programs are outdoors. Can you talk about what you guys are doing to keep those people safe?
You understand what?
Summer programs outdoors, and with the heat index expected to be what it is, you know, what you're all doing to make sure.
You're talking about the recreation programs?
Correct.
Okay, CA, do you have an update on where we are, Chris?
Hi. So in terms of the recreation programs, most of, particularly during the heat emergency, a lot of that will have to be indoors. And also at a lot of our parks and recreation centers, we do have supplies of water, and making sure that anyone who's in those facilities can stay hydrated, because that's really the most important thing. We will not see a break in the weather until probably Wednesday night, when the temperatures will go into the mid-70s. But your question also raises another point, which is it is important to know that throughout the day, and then even in the evening, we won't get much of a break over the next couple nights, because temperatures will remain in the high 80s to lower 90s.
Are you anticipating that any of those participating will have to be sent home due to capacity and social distance measures under COVID?
Not at this time.
But we are flexible, and the program was designed for the possibility that kids would have to be inside for weather. We were thinking rain, but also heat. So they are designed with small cohorts. Yes.
Can I ask another question on testing for Dr.
Yes.
Nesbitt? There's still complaints that folks are not getting their tests within the 7-day period. We've heard from a number of folks who still say they haven't gotten their tests at all. And we understand you had said that this has to do with the national, or I'm sorry, Mr. Geldart said this had to do with the national issue of a lot of people using the same company to test nationwide. Do you anticipate at any point that we might have to move back to asking those folks who are sick or who are showing symptoms to test instead of anyone who may just need a test or may need to travel to get tested?
So I want to make sure I understand your question. Are you asking if it is possible that during a pandemic we may have to prioritize serving specific populations? Mm-hmm. Yes, it is possible during a pandemic where medical surge may become an option during a pandemic that we may have to prioritize serving specific populations. We're in a pandemic. So the trajectory of a pandemic could change at any given time.
That's something that the city is weighing, that city officials are weighing right now?
At this point, we have the capacity to provide a test to anyone who needs a test. The turnaround times that we look at on a daily basis, we have every test that was provided to us by any lab, whether it be the commercial lab, the public health lab, hospital labs in a hospital. Those average testing times for today that posted were about 4.5 days. It's important for you all to note that any person who is in a hospital who is tested by a hospital lab, who are the sickest people in our city, they get their test in less than a day. There are commercial laboratories, their turnaround time, some of them range from 7 to 10 days. Our public health lab, which is providing most of the tests to our individuals who live in long-term care facilities where people are older and medically fragile, their test turnaround time is within 48 hours. So we're largely talking about people who could recover at home, who are being tested in mass testing sites, being tested in an outpatient environment by their healthcare provider, who are in this anywhere from 3 to 7 day window, depending on what contract the testing site, whether it be their doctor's office or public testing site, is using, and the volume of tests that come in on that particular day. What is interesting is that it does have an impact on our ability to do some of our public health work. So there's the clinical management of the individual. Is the individual going to, if they're critically ill in a hospital and their COVID status is in question, does it impact their ability to get one of the medical therapeutic interventions that could change their length of stay in the hospital and the one that could change their mortality if their COVID diagnosis is known? Those test results are coming back in less than a day. Is it going to change whether or not they should be isolated or quarantined? Anybody who gets a test should be quarantined. So while your test results are pending, you should be quarantining. You should not, if you have the desire to get a test, if a healthcare professional has advised you to get a test, you should quarantine. So you should already be doing all of the things that if your test came back positive, you should start doing them immediately after you have been tested. So we know that there are a lot of people who are going out and getting a test and saying, oh, I just want to know. If you're curious enough to know, you should be interested enough to protect everybody else who, if that test came back positive, you immediately start doing those quarantine behaviors. So yes, it does have an ability, it does impact the turnaround times being longer, impacts our ability to get a contact list, but you should be protecting the rest of the people you would come into contact with by not doing any activities that would put more people at risk if you went to get a test.
I might just also add that it speaks to the need of national leadership because these labs are, we can collect samples. We've pretty much gotten that down, but we need the labs to complete the test. And these labs largely are national in scope. So what they do in Delaware affects processing time for us here in D.C. So I would agree. I read earlier there was an editorial that we need a reset nationally. Some things are going out of control with this virus all over the country, and we can't have our national leadership throwing up their hands.
Absolutely.
This may be a time to recenter and reset, and testing is a big aspect about how this country gets on the right track. Yes, ma'am.
Yes, thank you. Is having the public testing sites closed today and possibly for several days more going to affect your ability to trace the spread of the virus in the city?
We do have some concern. We do about 40% of the testing to the general public in the district, but we do know that there is capacity that sits in the private sector, in doctors' offices, in health centers, that is not being fully used, that can be used. So that's why we're emphasizing that you can call your healthcare provider and get a test. Now, I do want to make sure that I'm articulating whether or not that is the thousands of tests that we do every day, whether or not that full capacity is there today. I don't want to emphasize it to that extent, but there is some capacity that sits in those healthcare, in our existing healthcare infrastructure, that can be used, and people should not hesitate to call their healthcare provider if they believe that they need a test, to get that assessment and be tested in those places.
And one thing I just wanted to go back to Stephanie's question, to be clear about what Dr. Nesbitt said, is that within our scheme, we already prioritize groups that have the highest exposure, whether there be people in hospitals or people in congregate settings supported by the district. And even during this time, that testing at those sites will continue. Yes.
Can I also ask, Mayor, about your letter on the budget that we just read? Just so I understand, are you suggesting that the CFO might look at not certifying the budget because of the cuts to the police budget? Is that?
Well, the CFO's job is to certify the budget if it's sufficient, and it's his job to call out insufficiencies when it comes to budget making. And we have some concerns about cutting the budget, which would trigger overtime costs that I'm not sure have been properly accounted for. CA, do you want to add to that?
Thank you, Mary. Yeah, I would just say, with MPD in particular, if you remove funds for personnel costs, and that is the ability to hire new officers, and we have something in the range of 300 to 350 officers that we know will attrition out of MPD for retirement purposes mostly, and you don't increase the force strength, then what remains is a pressure in the Metropolitan Police Department for the rest of that personnel to respond to events across the district. And so what we are concerned about is, by removing over $6 million of personnel costs from the budget without any increase in overtime, that you're going to create a problem, a spending problem in the police department budget for next fiscal year. So we think that's something that the CFO should look at, and something that they should gauge to ensure that funds are in fact sufficient to run the police department based upon the action that the council is taking.
And some of this is I just want to be clear that budget makers, and we encounter this all the time, it's one thing to say that you're going to reduce something, but if we discover 8 months from now that it just caused an increase someplace else, i.e. overtime, it's just not sound budgeting.
You say today, if the numbers stay the way they are on the second vote, you would recommend not certifying this budget?
That's not my job. But it is my job to make sure the CFO is doing his job. And I want him to be double sure that he's going to stand behind these certification numbers. And come January or March, when our overtime numbers are through the roof, I don't want to hear anything from anybody, because I warned them.
as long as we have a small crowd today, can I ask another?
I'm sorry?
As long as we have a small crowd today, can I ask another question?
You can ask
All right, thank you.
multiple questions when we have a large crowd.
Thank you. I wanted to ask, a few weeks back, you had been talking about these law enforcement officers, federal law enforcement officers in the district, and saying, if this can happen in Washington, D.C., this can happen anywhere. And I wanted to ask what you're thinking as you're seeing what's happening in Portland right now.
I don't know all of the details of what happened in Portland, but I've certainly seen the reports that you have seen, in that there are people being detained by officers. I'm not sure if those officers have been identified. I'm also not sure why people are being detained. I have had a couple of exchanges with my fellow mayors, and so I'll be looking into that in more detail today. But it is true, I said clearly then, when we had federal enforcement encroaching on the district, that all Americans should be concerned about that. If we allowed the Attorney General to be directing local law enforcement matters, we would be in trouble. Yes.
Can you also discuss, with the city administrator, the police emergency legislation? Did you get a chance to review that and your comments on that?
I am reviewing it. We continue to review it. I think that this week I'm required to act on it.
Anything that you would ask them to definitely take a look at, and what you did find in it?
Oh, we've asked the council to look at a number of things. They made some changes in the replacement emergency, and we'll continue to work on it.
Mayor Bowser, can I ask you a separate question? First, the update on the shooting from yesterday, but regarding what happened this weekend, the loss of John Lewis on Friday. You were with him in his last public appearance. Can you please weigh in on what that was like?
Sure. So I think you've seen from all of the outpouring of messages about John Lewis how impactful his life was, being the youngest speaker at the March on Washington. And he shared with me on Black Lives Matter Plaza. He kind of looked around and he said, that's where I stayed right before the march and looking at the Capitol Hilton. So it was in some ways just a full circle moment that we got to share in. And I think that he was a man who knew that he was in the sunset of his life, but also knew that it was important for him to bear witness to the moment. And that moment in Washington, D.C., just like the moment he had some 50 years earlier for the March on Washington, was important to him. So I'm grateful for his life. I'm grateful just personally that I got to share that moment with him, as well as a pilgrimage to Selma, which was also very powerful for us and a group of Washingtonians who went with us on the pilgrimage to Selma. It is something that I wish for every American, because you will be able to go to places that saw and visit people who are still alive. But we're losing those people, as you can see, who had to put themselves in front of batons and water hoses and vicious dogs and ominous weapons, all because they knew that they shouldn't be terrorized in their own country by police, by the governors, by the law. And that was John Lewis. And I think what was also so remarkable about him is that he did not let that experience embitter him, but actually he embraced his role in the movement up until his death. So we're just really grateful for his life.
The follow-up to any updates to the
Unfortunately, Stephanie, we don't have much more to add from what we saw yesterday. What Stephanie is referring to was a brazen shooting that happened mid-evening in Ward 1. And on a commercial strip, a strip that where people were going about their daily lives. We know that 3 men opened fire, it appears, at other men that they were targeting. And we had multiple people shot and one succumbed to his injuries. So the police continue to investigate this matter from people we think who are known to the police and to be involved in a neighborhood conflict. Okay. Yes. Last question.
Can you give us an update on where we are in the city in terms of homicides as of June 1st? And also with regard to the increase of shootings that we've seen in the city, is there a new plan, any way to address that?
Actually, we expect to be talking about some more detailed strategies, and we'll do that in the coming days. Where we are, I don't know the numbers specifically off the top of my head, but we're too high. And we have an increase over last year. The trajectory doesn't look good, and we have an increase in the numbers of shootings that we have. Every thing that we know about this crime is that these crimes are that they're people who have probably used a gun before, may have been in police custody before, may have been charged with carrying a firearm without a license, or maybe felons in the possessions of firearms, all illegal. And we know that they're back on the street. So those are some of the facts that we know, and we know that the proliferation of guns is very concerning. Our departments, our summer crime initiatives are all in effect. The violence prevention programs that many people are focused on right now are also in place. We continue, even in the face of this pandemic, to be focused on our safety net as well, to make sure people have summer activities, summer jobs programming, our recreation programming. All of those things are in effect. We likewise have been looking at national trends, which in major cities across our country, unfortunately, we see similar trends and upticks in the use of guns and in violence. So we're focused on that. We'll have more to say about specific strategy differences as our teams are developing and implementing those.
With regard to that shooting, I understand you and the chief have said that you believe it's targeted. Do you have any indication that it was maybe one person or the entire group there, all the people injured, or were those bystanders, innocent bystanders that were also wrapped up?
I can't say that because I think that MPD is still working on the victims to know more about them. Yes.
Can I ask Dr. Nisbet one more question about the coronavirus numbers today? That graph that you showed about we're at 2.6%, we need to get to 60%. Can you talk about the strategies to get there and what we're doing? We haven't gotten anywhere close to 60% yet.
Wear a mask, keep 6 feet of distance, and choose your activities wisely. I think we have a challenge with, and we're really reviewing this and looking into this with the choosing your activities wisely aspect of containment and moving toward containment. And in the mayor's opening comments, she reiterated that a few times too, and I'll go back to it. And that even goes to when we're having these gatherings in our private homes and the types of activities that we participate in on a daily basis, the amount of times that we go out to social events, the types of social events that we go to very early on. when we were talking about essential activities, we had people thinking about the number of times that they went to the grocery store and, go every 2 weeks. And I think people have gotten very relaxed around those types of recommendations and are almost, maybe now are making a run every day. Oh, I need one item and I'll go to the grocery store. We still need people to be very judicious about choosing their activities and being in that kind of posture. And even with, your travel, your essential travel versus non-essential travel, we want people to be very focused on choosing their activities wisely in a way that they haven't been heretofore. And even when we've given instructions on how to social distance, making sure that people are actually socially distant when they go into these venues. What does that mean? Are you socially distant in the workplace? How often are you wearing your mask? Are you giving space in the elevator cabs? All of those things really make a tremendous amount of difference, and we need people to be adhering to them and taking them very seriously.
New restrictions or bringing back some of the old restrictions to make people do some of that social distancing?
Well, we continue to have those discussions, and we'll have those discussions, and we talked a little bit about that Friday, as there were the 3 things that gave us concern, and where there may be some opportunities for intervention.
I apologize if I missed this on Friday, but speaking on masks, is there anything more to the ACLU raising concerns about DC police not required to wear masks?
No. Okay. Thank you, everybody.